You will be learning the eyeball. Now, what do you think? The eyeball is a part of the head and neck or part of the brain? Can you tell me? Is a part of the head and neck or the brain? Part of the head and neck, because we can see in the head and neck region we can find the eyeball, but it is a prolongation of the brain. It develops from the diencephalon. There are two diverticulum developing from the diencephalon. Okay, so developmentally is a part of the brain, rather it's a moving brain. So, and you know about the gross structure or gross anatomy of the eyeball. Already you have some idea from childhood days. This picture shows the section of the eyeball, which is quite familiar to you, I think. So from outside inwards, it has got 3 layers. The most outside layer is the fibrous layer. The next one is the middle layer, that is the vascular layer. Okay. And most inside, that is the nervous layer. So basically we know the so most outside we can get this fibrous layer, which is called the sclera, which becomes transparent in front, which we call it as the cornea. Cornea. And this area between the sclera and the cornea, there is a depression we can find, and this area is called the circular depression, that is the limbus. Some of you is uttering the term the sclerocorneal junction. And in this sclerocorneal junction, we can find the end of the sclera. End of the sclera, this area is called the scleral spur. Scleral spur. And within that scleral spur, we can detect one canal. We can detect one canal. Okay. Which is called the sinus venosus sclerae. Sinus venosus sclerae is a round tubular structure within the sclera. And that too is also known as canal of Schlem. This is very important for the ophthalmologist, because we know this is the area between, this is the iris and the cornea. This is an area which is called anterior chamber of the eye, and similarly behind the iris, okay, and there is, we will get suspensory ligament and the part of the ciliary body. This area is called the posterior chamber. And we know this area is occupied by one fluid, watery fluid, which is called aqueous humor. Okay, that is absolutely watery. So that aqueous humor is formed from the ciliary body. It percolates through the posterior chamber, then it reaches the pupillary aperture, then enters into the anterior chamber, and ultimately it is drained into the canal of Sclem or the sinus venosus sclerae. And there is a meshwork or network present in between this angle, between this iris and the cornea, iridocorneal angle. There is a trabecular meshwork or network, and it is like this network, and there are some open space. These spaces are called the spaces of Fontana, through which the aqueous is drained into the canal of Sclem. Then ultimately from here it drains into some verticose vein, 4 to 5 verticose vein of the sclera, and ultimately it reaches the ciliary vein and so on. So this is the sclera. Now what is sclera? Sclera is a fibrous structure, and a part of the sclera is also been covered with another layer, which is the conjunctiva. We can find it covers the sclera. Okay, and whole eyeball, you should remember, is covered with another capsule or fascia, which is called Tenon's fascia or fascia bulbi or fascia bulbi. You will learn when you will, if you do house job in ophthalmology or any diploma or postgraduate degrees in ophthalmology, there is called subtenons. They often use the subtenons injection of some material, injectable material. So they perform that procedure and they put the injectable material just below this Tenon's capsule, which is called. So we should know. Now this sclera you can find, we can find there are so many extraocular muscle like superior rectus, inferior rectus, lateral rectus, medial rectus, and some oblique, superior oblique, inferior oblique. There are some muscles, extraocular muscles. They are inserted over the sclera at different position. But all these recti muscles are inserted anterior to the equatorial region of the eye, except the oblique muscle. That means the superior and inferior oblique, they are inserted behind the equator. Superior oblique and inferior oblique. And you know, most of the extraocular muscles are supplied by oculomotor nerve, except lateral rectus by the sixth nerve, that is the abducens nerve, and superior oblique by trochlear nerve. We know that big term LR SO4 and LR6, except SO4 and LR6. So this sclera is the area for insertion of the extraocular muscles. And sclera is also invaded by some varicose veins, 4 to 5 varicose veins. And also we can find the posterior part of the sclera is being invaded by this optic nerve. Optic nerve, here you can find one single nerve. There are so many nerve fibers. Within this single optic nerve, there are so many nerve fibers. They enter in through the posterior part of the sclera, where 3 millimeter medial to the posterior pole of the eye. Okay. So this area, if there is entry of so many nerve filaments, so sclera becomes very much weak, because there are so many brains which have been formed by these neural elements. So it becomes a sheave-like, that means net-like. Again, we can assume there is a net-like structure, a sheave-like structure. Sheave. What is sheave-like or net-like? Exactly. So that we should call it as, that is lamina cribrosa. The sheave-like structure is cribrosa. Cribri, from plate of the 8th point, we have find so many openings. So lamina cribrosa, as it is present in sclera, scleri, lamina cribrosa scleri. If we know the meaning, then we can remember the term. So it is called lamina cribrosa scleri, and that is the weakest point. So if there is an increased intraocular pressure, okay, so it will try to, there will be a bulging of this area, okay. So the contents will try to come out through the weak points. So lamina cribrosa is a weak point. So a part of the eyeball or interior of the eyeball may try to protrude, which is called, protrusion is called the staphyloma. Any part of the eyeball is coming like hernia. So it is called staphyloma, any part of the eyeball. So that is the area we can get the protrusion of the interior of the eyeball. And here we can find not only this optic nerve enters, and also we can get the entry of one artery and one vein. Can you see? That is the central artery of the retina and central vein of the retina. And it ultimately, it divides and subdivides artery, and ultimately we can get the retinal arteries and retinal veins. And if we see the interior of the eyeball with a instrument like this, that is called ophthalmoscope. And if we can perform the ophthalmoscopy, that is called direct ophthalmoscope, we can see this picture, absolutely. Artery and veins, and we can differentiate the which one is artery, which one is vein. Artery is bright red and vein is dull in texture. The caliber of artery and vein, the ratio is 2:3. Okay. So we can find these are the several branches. One goes to the temporal side, one goes to the nasal side, supratemporal, infratemporal, supranasal, infranasal, several branches. And also we can find this point. This point is called, there is a depression we can find, and this is the area. I will show in other slide. This area is called the optic disc. Okay, and there is one depression. That area is called blind spot, where we do not get any cone cells, because within the retina we will get layer of rod cell, layer of cone cell. Rod cells are mainly for dim light vision, and cone cells are for bright light vision. When we are going outside in sunlight, the cone cells are active, and when we are entering into this classroom or entering into any big cinema hall, suddenly we cannot orient, but it takes time for adaptation by the rod cell. That is called dark adaptation. Okay. Similarly, when you were sleeping in a dark room, suddenly if we go outside, we cannot tolerate the light. But at that moment, the cones are not active, so that is light adaptation. Now, so this is the sclera, and you can appreciate this sclera at forms posterior 4/5 of the eyeball. 4/5 of the eyeball. And anteriorly we can get this area. This is the cornea, which forms the 1/5 area. It may vary from one book to another book. In some book you will get 5/6, 1/6, whatever might be. So next is the, now about the cornea. Though it is, you can assume it's a single layer. You may think that it is a single layer of cells. There are 5 layers which are present within the cornea. From outside, inwards, you will get so many layers. That means epithelium. The next layer is Bowman's membrane. The third layer, which is, we can find, this is the white layer, which is called substantia propria. Then we can get another layer here. Okay. So we can find that one. So we can find stratified squamous epithelium. And this epithelium is thin at the center, thick at the periphery. That means in the center. And there are two parameters. One is transverse diameter and one is vertical diameter, which we can calculate in a special machine which is called keratometer. Those who wear contact lenses, you might have visited the eye clinic. There is a telescope-like structure. The ophthalmologist exams telescopic, and basically there is a keratometer by which he or she can identify or calculate the vertical and transverse diameter of the cornea. Here we can get the connective tissue. In the stroma, there is a substantia propria or the stroma. Here you can get the connective tissue, but there is a difference. Here we can find these corneal corpuscles. That means within the stroma there are collagen fibers, 50 to 60 layer of collagen fibers. And one layer is oriented like this, one layer is horizontal and another layer is perpendicularly oriented. The next layer is again horizontal and another layer is perpendicularly oriented. Okay, there you can find these are the layers of collagen tissue. And in between the layers, we can find some spaces which are called the corneal spaces. And within the corneal space, we can get these corpuscles. So, corpuscles are absent in this stroma, whereas it is present in the substantia propria. So, during any injury, if we injure this, suppose there is a pinprick injury or thorn prick injury, any sort of injury, it may affect the epithelium, okay, it may affect the Bowman's membrane, it may affect the substantia propria. Up to this, okay, it will regenerate, it will try to regenerate. But if it reaches to the Descemet's membrane, what will happen? There will be protrusion of this layer which is called the, or during any surgery which is performing in the anterior chamber, there is a endothelial loss. There is protrusion of this layer. This is also a fibrous layer which is the Descemet's membrane. So that layer will enter and it will form descemetocele. And this কোথায় গেল আবার কোথায় চলে গেলি and this layer is unique because if we concentrate on this figure, this is the iris and this is the cornea. Most interior layer is the endothelium. Before that, we are getting the Descemet's membrane. From here, from the Descemet's membrane, actually there is this layer actually protrudes, and also this layer covers the anterior surface of the iris, which is called pectinate ligament of the iris. So that Descemet's membrane, from there the fibers are coming and covering the iris. Not only the iris, it covers this area that is the canal of Sclera. We know that is the trabecular meshwork. They are nothing but parts of the Descemet's membrane, Descemet's layer. Okay. So these are some so this is the cornea, what we can get, okay. And you can see this cornea is also, the anterior surface is convex, posterior surface is concave, and it helps in accommodation. Anterior curvature of the cornea is also bent during accommodation reflex. Anterior curvature of the lens, this is the iris diaphragm where we can get the lens. Anterior curvature of the lens also there is, which provides the refractive index. There is refraction, the change of light rays. What is refraction? Denser media, rarer media, so the light rays deviates from denser to lighter area media, it deviates away from the normal line, and vice versa. So this is the same thing, because the light is entering and it has to converge. So there is a refractive index. This cornea, aqueous humor, the lens, they are providing they are acting as a refractive index. They are causing the refraction so that light can converge. Where it will converge? At the retina, nervous layer. So what is the refractive index? Actually, we know the power of the lens is, the total power of the eyeball is around 60 diopter, among which 20 diopter is contributed by the lens. এই যে চশমাটা পড়ে আছে ও, দেখা যাবে 4 diopter 5 diopter কিছু একটা, তাই তো? তোমার কত দেখি? আরো বেশি আছে, আরো 7-8 এর কাছাকাছি আছে, তাই তো? হ্যাঁ। So this is providing, this is a refractive, this is a refractive area, refractive media. Concave lenses are there, so many concave lenses you can assume. So there is a refraction. So the lights which were going to the extreme periphery, ultimately it will get converged. Similarly, the power of the lens is 20 diopter, and the rest is provided by the cornea, aqueous humor, so and so. So mostly by this area is provided, this refractive index is very high, okay, and it is being contributed by the cornea. Next layer is the uveal tract or the vascular layer. That we can see it here, the next layer. Okay. Though this picture is not very good, okay, because we cannot differentiate the retina and the choroid. আরেকটা ছবি আছে না? এটা না, আর ছবি নেই, আগের ছবিটা না, ওইটা কোথায় গো? ওইটাতে আছে। Now here we can see this. So the next layer is, though it appears as blue, actually this is brown black in color. That is the whole tract is a circular tract. Okay. So this is called uveal tract, which consists, the posterior part is the choroid, next part is the ciliary body, and the most anterior part is the iris. So that vascular part consists of three subparts. The posterior one is the choroid, intermediate one is called the ciliary body. Okay. And in most anteriorly we get the iris. Now here we can find the sclera, and in between sclera and the choroid there is a fibrous layer of separation, which is called suprachoroid lamina, which separates the choroid and the sclera. Avascular structure. Okay. Just imagine there is one layer in between the choroid and the sclera. Suprachoroid lamina. Now this choroid has got so many parts. One is called choroid proper. First is the suprachoroid lamina, then is the choroid proper. And most inside we will get another layer, okay, or pigment layer, over which the nervous layer of the retina rests. So that is the pigment layer. Actually this pigment layer is the part of the retina. Okay, you can see this area, this layer over which the retina rests, that is the pigment layer. And you can find the nervous layer ends here. Okay, you can find ends here with a serrated margin. That is called ora serrata of the retina. But you can find this layer is continuing and it is covering this part, and also ciliary body, and also it covers the iris also. So retina, the nervous layer ends at the ora serrata, you can find. But the pigment layer of the retina, it goes to cover this area. So this is choroid. It is up to this. Then we are getting this circular area that is called ciliary ring. This area in between the ciliary body and the choroid, this area, the circularly it is present all throughout. Okay, that is the ciliary ring. So it is also been covered by that pigment layer. The next one is the ciliary body. Here we can find some processes which are called the ciliary processes, and inside we will get the ciliary muscles. It is also been covered with that layer, pigment layer, and after that it also covers the iris. So the part which is covering this one the ciliary process and ciliary ring, which is called ciliary part of the retina. Ciliary part of the retina, that pigment layer is called. And the part which is covering the iris, which is called iridal part of the retina. Parts ciliaris retini, parts iridis retini. কঠিন হয়ে গেল যদি মনে না রাখতে পারো ciliary part of the retina and iridal part of the retina, or parts ciliaris retini, parts iridis retini. So this the choroid, and again it has got some layers. আগেরটা আবার ফেরা যাবে? Again we are coming back to that previous slides. Here we can find the choroid. Okay, we can find that area is the choroid, and within the choroid there is choroid one. We can get suprachoroid lamina, then choroid proper, then basal lamina. There are 3 layers. And within the choroid proper, we can get some blood vessels. Okay, because it's a vascular structure. Choroid is a vascular structure. When we are operating, we can find there are blood vessels. But blood vessels are coming from there are anterior and posterior ciliary arteries. So they are entering and it forms a meshwork of blood vessels within this layer. So within the choroid we can find the pigment cells. Within that choroid we can get the blood vessels. And in the lowermost layer or innermost layer of the choroid, there is a which is called the choriocapillary layer, where we can get, or basal layer, where we can get some capillaries also. And that layer is very important. Suppose this is the choroid and most inner layer is the choriocapillary layer of the choroid. From here, the nutrition is given to the outer layers of the retina. Retina not only gets its blood supply through the central artery of the retina, okay, but also gets its supply from the choriocapillary layer of the choroid. Okay, that much you just remember. Try to remember that one. Now this area in between the ciliary body and the choroid, this area is called the ciliary ring. Here we can get some projections, ciliary rings. And the next area is the ciliary body. And ciliary body is very important because we can find some processes from which are called the ciliary process, and upon which we can get some ligaments or suspensory ligaments are attached. And these suspensory ligaments are attached also on the other side, on the periphery of the lens. And here we can get some muscles inside the ciliary body. They are called ciliary muscles. Again, in detail, if you want to know, there are 2 types of muscles. One is meridional muscle, one is circular muscles. Okay. Actually, these muscles centrally we can find the from the sclera. This is the scleral spur. From scleral spur to the ciliary process, 1 fibers are oriented. They are called the meridional muscles. And on the periphery, we are getting the circular muscles. These circular muscles are very much abundant in hypermetropic eyes. Plus power. Hypermetropic eyes. And those circular muscles are very scanty or absent in myopic eyes. And what is the function of these ciliary muscles? You can find these muscles. This is the ciliary muscles. When this muscle contracts, this ciliary process, it moves forwards. Okay, this whole thing moves forwards. And there is a relaxation of this ligament. If there is relaxation of the ligament, then anterior curvature of the lens will be more prominent, pronounced. So it will help in accommodation, near vision. Though that elasticity or the plasticity of the lens decreases with age. At the age of 40 onwards, the bulging power of the lens is lost. That is called presbyopia. Now, this is the iris. You can see that these are the different muscles we can find, okay, ciliary muscles. And this is the iris. Okay. And iris, actually, it gets the name, it is because of the color. There are different colors of the iris. It forms a diaphragm between the posterior chamber and the anterior chamber. And centrally, this is open, which is called the pupil. Now, color of the iris in albinos, it is white. In some white colored persons, we can find blue-white, and Negroes and Indians, it is brown-black. Colors, because we get some pigment cells within the stroma of the iris. When the pigments are absent in albinos, it is white. When the pigment cells are present on the posterior aspect, posterior surface, it appears as blue. When it is within the stroma, it appears as a brown or black. And there are so many contact lenses which can change your the color of your iris. Colored contact lenses are there, and those who are fond of cosmetic, they wear occasionally. They become white pupil becomes, there is an, যেরকম কাকের যেরকম ময়ূর হওয়ার ইচ্ছা হয়, আমাদেরও তো ইচ্ছা হয়, কাকেরও তো ইচ্ছা হয়, আমাদের ইচ্ছা হয় মাঝে মাঝে একটু কালার্ড কন্ট্যাক্ট লেন্স পরে একটু অন্যরকম হই, হওয়ার তো ইচ্ছা হয়। নানা রকম কায়দায় ময়দা ভাজা বলে না, কায়দায় ময়দা ভাজি আমরা মাঝে মাঝে। But originally that appears as brown black color. Now within the iris there are so many blood vessels, and there are within the iris we can get two types of muscles, because iris actually, what is the function of the eye? It helps in light reflex. When there is fall of light, there is constriction of the pupil, and in dark place, there is dilatation of the pupil. So there are two groups of muscle, one is constrictor pupillae, one is dilator pupillae. Constrictor pupillae is supplied by parasympathetic nerve through short ciliary nerves. Ciliary ganglion, from there short ciliary nerve. Aro egabo? Eringer-Westphal nucleus, from there ciliary ganglia, postganglionic fiber moves along the short ciliary nerve and innervates the sphincter pupillae. Okay. And when you are nervous in your examination, what happens? Sympathetic stimulation. There is কি জিজ্ঞেস করলো কি না ওটা তো পড়িনি then that is dilatation of the pupil. So that dilatation of the pupil is caused by sympathetic stimulation, sympathetic nerves. Sympathetic nerves are coming from where? Superior cervical ganglia. Actually it is all definitely coming from the T1 and T2 segments of the spinal cord, and it enters. There are three sympathetic ganglia: superior, middle and inferior cervical ganglia. Behind the carotid sheath, what you got? Sympathetic nerves. Carotid sheath e ki peyechile? Carotid artery, internal jugular vein, in between vagus nerve, and behind the sheath sympathetic chain. দেখতে পাওনি? পেয়েছো তো? পেয়েছো? ছিল তো? আর কার্ডিয়াবারটা বার করলে আবার দেখবে। So that is cervical sympathetic nerve, the cervical, superior cervical ganglia. From there, this nerves moves along the carotid artery and ultimately reaches the ophthalmic artery, and ultimately it reaches the eyeball and it supplies the dilator pupil. Okay, so there are two sets of muscles. আবার ওটাতে ফেরা যাবে? ওটা কোরাইড হয়ে গেল, ডাক্তারি অ্যাকোয়াসিমারে চলে গেল, এলোপাথারি লেখা আছে, রেটিনায় চলে গেল। যাকে তাহলে আর আইরিস সম্বন্ধে লেখা নেই, আগে ছিল তো, সিরিয়ারি বডি অ্যান্ড আইরিস। ওকে, যা বলার বলে দিয়েছি, ঠিক আছে। সিলিয়ারি বডিও বলে দিয়েছি, কোরাইড বলেছি। নাও অ্যাবাউট দ্য লেন্স, উই আর গেটিং biconvex lens. Both the surfaces are convex. ঠিক আর ভালো ছবি আছে না, ছেড়ে দাও। আগেরটাতে, হ্যাঁ এটাতে আছে, এইটাতে আছে। So this is what we can get. The posterior surface, this is the anterior surface. Posterior surface is more convex and it is accommodated within a fossa which is called hyaloid fossa. There is a hyaloid canal which is present during the embryonic period, through which the hyaloid artery actually enters and supplies the lens. Make a circular opening in the anterior capsule. It's covered by anteriorly one capsule, posteriorly another capsule. So during surgery we create a circular opening which is called capsulorhexis. In phacosurgery, which is the most modern surgery, even there is another advancement. Nowadays we are using the laser to create the opening in the anterior capsule. Whatever might be the process, we are concerned with the anatomy of this area. So within the lens we can find a center or nucleus. Okay, this is the artificial lens. Okay, this is the optic and these are called the haptics. And this is the pupillary aperture. We actually remove the lens and we create an area through which the lens is put within the, we can find this is the anterior capsule, this is the posterior capsule, part of the anterior capsule. Here we are getting the anterior capsule and posterior capsule. Here we are getting the posterior capsule is intact, the anterior capsule is removed, a circular fashion. By a circular fashion, the anterior capsule is removed and we have put the lens. So, in this area, we are getting a lens and this is the cortex of the lens and this is the lens nucleus. And below the capsule, we can get the lens fibers and lens cells. And this lens cells moves from these fibers, moves from the periphery to the center. But it never reaches from one pole to another pole. So lens capsule, lens fibers, lens nucleus, lens the cortex, that much is enough. And what is the power of the lens? Generally, it is 20 diopter, 20 to 25 diopter in normal person. Okay. চলো এবার ওই দিকে আবার চলে যাই। লেন্স হলো কি আবার আটকে গেল কেন? Now this is the aqueous humor, what I have already come across with the, it is secreted from the ciliary processes, okay, and it moves through the posterior chamber, enters into the pupillary aperture, enters into the anterior chamber, and ultimately it drains into the canal of Sclera, and here is the trabecular network. Okay, so this is the aqueous humor, and if there is any block in drainage, there will be increased intraocular pressure. তাহলে আমাদের জানতে হবে what is the normal pressure of the eyeball? It is around 15 to 20 millimeter of mercury. So there are, if it is increased, it is called glaucoma. Glaucoma might be of two types. One is open angle glaucoma, angle between this is the iridocorneal angle. When it is short, this is narrow angle. Narrow angle glaucoma. When the angle is short and there is a hindrance of drainage, this is iris and the cornea, iridocorneal angle we can find. So when this angle is short, there will be obstruction of the flow. So that is called narrow angle glaucoma. Whereas there is another glaucoma which is called wide angle glaucoma. Their angle remains open, but the meshwork in the trabecular meshwork, the patency of the trabecular meshwork is lost. There is a patency, spaces of Fontana. So when it is lost, it is called wide angle glaucoma. So this angle is identified by one instrument which is called gonioscope. Gonioscopy, that means the measurement of the angle. There are 4 different grades of angle. Schaeffer's gradation 1, 2, 3, 4. Need not to know at this level. চলো এবার রেটিনার দিকে যাই, রেটিনায় হাঁটতে হবে তো না। vitreous is what is vitreous? Vitreous is a jelly like substance which is present in it is a part of the behind the lens, behind the posterior chamber. So there is a chamber. There are two segments, anterior segment and posterior segment. Up to the lens, there is the anterior segment, and beyond the lens, there is a posterior chamber, posterior segment. In eyeball, it is called two segments. One is anterior segment and posterior segment. The eye surgeons are either anterior chamber specialists or posterior chamber specialists. Posterior chamber consists of vitreous and retina. Okay, so it is a part of the posterior segment. Okay, so we can find this is a vitreous. Here we can get vitreous. Okay, so what is vitreous? It is jelly-like substance, majorly the white watery material, and also hyaluronic acid and other leukoproteins we can get, absolutely jelly-like. During our eye surgery, if the posterior capsule is affected, then vitreous comes out. Most inner layer is the retina. Retina ওই ছবিটা বার করতেই হবে। Now we can find the most inner layer is the retina. Retina is continued in front from the ora serrata. It ends in a serrated margin, which is called the ora serrata, and it is continued behind up to the optic nerve. Actually, within one layer, there are 10 layers of. There are 10 layers. This is not a single layer. But basically, there are two layers. One is outer pigment layer and inner nervous layer. Okay. And within the nervous layer, you will find so many layers, like layer of rods and cones, external limiting membrane, outer nuclear layer, outer plexiform layer, inner nuclear layer, inner plexiform layer, layer of ganglionic cells, nerve fiber layer, internal limiting membrane. স্যার কি বলছেন? একটা ছবি দেখার চেষ্টা করি, তাহলে যদি খানিকটা বোঝা যায়। বেসিক্যালি কিছুই নেই, খুব সহজে যদি বুঝতে চাই, দেখো এখানে মোস্ট আউটার লেয়ার দেখো, সেখানে দেখো বাইরের দিকে পিগমেন্ট লেয়ার থাকতে পারে। This is the pigment layer. Okay. Then we are getting the layer of rods and cones. Rods and cones. They are the photoreceptors. Rod for dim light vision and cones for the bright light vision. খুব সহজ করে দেখো, এই দেখো এই ছবিটা কিছুই না, আগেরটাতেই এই আগেরটা কোথায় গেল? হ্যাঁ, শুধু মনে রাখো এগুলো হচ্ছে ফটো রিসেপ্টার্স, রডস এন্ড কোনস। ওকে, রডস এন্ড কোনস। আর কি লেয়ার আছে এখানে, কি কি সেলস? হোয়াট আর দ্য আদার সেলস উই ক্যান গেট? We can get, this is the layer. We can find these cells, they are called the bipolar cells. Okay, bipolar, this cell has got two pole, this is one pole, this is another pole. One pole is making a synapse with the rods and cones, and another pole is making a synapse with these ganglionic cells. Basically, rods and cones, bipolar cells, and ganglionic cells. 3 layers basically. Among them, this is the photoreceptor, forget it, and this is the bipolar cells. This is the first order neuron, and this is the second order neuron, and this is the action of the second order neuron is continued within the retina. So from outside inwards, this is the pigment layer of rods and cones, then outer nuclear layer, outer plexiform layer, inner nuclear layer, inner plexiform layer of ganglionic cells, nerve fiber layers, and this is the inner limiting membrane, and here we are getting the outer limiting membrane. So this is 10 layers we can get within one retina. Now we can find the picture of, this is the ophthalmoscopic view of the retina. Here you can find this area. This is called optic disc, and you can see the optic nerve, and you can see the blood vessels are coming out. Some are darker, some are bright red. Bright reds are the arteries and darkers are the veins. And 3 millimeter on the temporal side we can find this area. This is called the macula lutea, where we can get a depression which is called the fovea centralis. So this is the picture of the retina. Okay, what we can get, and we can see the pigment cells. These are coming from this color is coming from the inner choroid layer. Okay, so this is the picture of the retina. So the blood supply, outer part is coming from the choriocapillary layer, inner part is coming from the central artery of the retina, and venous drainage by the central vein of the retina. So there might be occlusion of the central artery of the retina and central vein of the retina. Like CVA in our brain, there might be vascular stroke in the eyes also. If the central artery of the retina is blocked, sudden loss of vision. Okay. And this optic nerve is coming from the 3 millimeter medial to the posterior pole of the eyeball. So blind spot, we got it. That is, the blind spot is nothing but the optic disc.